Renee. Here we are, another episode of Stepping in It.
I'm very excited about this one, man. We've got ourselves a Halloween special, and I am here for it.
I forgot to bring my mask or
Oh,
something, or
no.
spooky sound effects, but it is going to be a scary, scary episode.
I'm very excited. I really want to dive in. But before we get to the scariest things going on in behavioral health in 2025, Jason, what's going on the farm? What do you guys do with the farm for Halloween? I think you've told me this before. Is this the soup? Is this the soup thing, or is that a different holiday for y'all? There was a holiday that's all about
Oh.
soup. Maybe that's a different one. But is Halloween? Oh no, you and your wife really go out for Halloween and you like to dress up and stuff. So this year, do you have a plan, or is that still under wraps, top secret?
We don't have a plan at all. There is the big Halloween party our neighbors have across the street. I haven't planned accordingly at all this year. It always runs into harvest, right?
Oh, that's
Because
right.
it's like, combining and then having to come home and get dressed up for Halloween. So we'll see what happens this year. But when I think about Halloween, I think about there's some of the fields that we have that are surrounded by timber. We have some like smaller
Mm,
20 or 30 acre plots.
yeah.
And it's like we're always back there late at night. There's a full moon. And every now and then the coyotes wander out
Oh
around
yeah.
the tractor. And so you don't want to get out of the cab sometimes in some of these places. You just, no matter what happens, you just stay inside, and make sure you don't go out and about. So that's always what I think about of Halloween. Because when I was young, out helping my dad when I was in high school on the farm, it kind of freaked you out when you're out there and the coyotes are wandering up and all the other, you just see the lights, you see all the eyes looking at you from the
That
timber
sounds
when the
like fun.
tractor shines that way. So yeah, that's Halloween in my head.
Yeah. Well, I don't normally dress up, but this year I have the perfect I have the perfect outfit, just the perfect one. It is 100% me. And I'm not going to tell anybody what it is today. You're going to have to check my socials to see
Wow.
how
I
it
can't
came out.
wait.
And it's a multi-state endeavor to pull this off, and I'm
Wow.
super excited. So,
Wow.
Jason, today we're going to be talking about the top 10 things that are not great going on in the behavioral health system. And I think it's going to be pretty fun, but let's start at the number 10. We'll work our way down to the best. But number 10 here, Jason, is a unique idea that you come up with that I thought maybe you should share with everybody. What's the scariest thing that you've learned top 10? Number 10.
Oh no, we're starting at the top of the list. I just can't reverse number them.
Oh,
We
I
end
see.
with
We're
that
starting
one.
at the top of the list. I
Start at
hear
the
what you're
top.
saying.
Even though it says one on our
Now I'm
shortcut
very
list, I
backwards.
don't know how to make
Okay.
the list go 10, 9, 8, 7, 6. I only know how to make it go 1, 2, 3, 4, 5. Like
Okay.
really technologically limited right
All
now
right.
this
So,
morning.
all right.
Can't help
So
it.
the top on the list, Jason, still is an important conversation. You want to go with
Right.
that one first? Go with that
So
one.
scariest things we're facing as an industry, number 10 is the ongoing continuing resolutions with the federal government, Medicaid cuts, and the impending explosion of uncollectible debt in rural healthcare. Right?
Yeah.
I just put it all in the funding basket. Scary. Providers, hospitals, healthcare in general. It's scary right now.
It really is. The unknown, to your point about being out in the fields and unknown what kind of creatures are coming at you with their eyes. It's kind of the
Mhm.
same thing, the same feel for these people that are hospitals and whatever. And they used to have maybe set ways they got paid or set amounts of money they got paid, and those things are all changing. And so that is the unknown is super scary. I appreciate that. All right, so the next one on the list, Jason, and this one's a good one too. What else is the next scary topic for us going on into the year this year?
It's always a scary topic, and it's stigma because it gets in the way of everything. I just read 3 more articles this morning about the impact of stigma on opioid treatment, and so we still see stigma across rural areas as being a detriment for people finding care.
Yep, and with my population coming out of prison and parole, the stigma maybe with their type of crime that they committed or being on a sex offender registry or all those different kinds of things really make it difficult for them to find housing. And so in the stigma is creating housing shortages across all kinds of things. And we have so many more additional unhoused people. And in many cases, the stigma is what's attached. And the stigma could be, poor credit history. It could be all kinds of things, but it really gets complicated when it's attached to a diagnosis or a substance addiction. And so you're right. That's a really scary one. All right. So the next one on our list is what?
THC, legalizing pot all across the country and not getting our hands around the real cost socially of that. We see the data of drinking decreasing, but that doesn't really tell the story because we're just replacing using alcohol with other substances that are detrimental to workplaces and communities and everything else. And for example, I'll tell you, we were just in Texas, and the Texas legislature voted to limit the scope of selling THC all across the state, and Governor Abbott vetoed it. Even though the will of the people and the legislature was we've got to limit that, I think there's probably some corporate dollars at work here, Renee, because that's what's driving the proliferation of pot across. And so, one legislator said we've got 4 times as many head shops as we do McDonald's in the state
Ooh.
of Texas, and we believe that it will double. Not the number of McDonald's will double, the number of head
Mm.
shops will double because of that veto. And now that's where they see the dollars in selling.
Yeah. My scary side of this, you guys can look this up, but more and more research is showing that this adds to psychosis. And sometimes it's not doesn't become a treatable psychosis. And for folks that are in that normal age range of people that can have psychotic breaks, especially men in the ages of their early 20s, using marijuana actually enhances and makes that psychotic break worse and can actually lead them into the diagnoses towards schizophrenia and other psychiatric issues. And so it actually really is a scary drug, and the fact that we're just proliferating it and letting everybody have it when there are actual research links to psychosis is really scary. And it's really hard to tell our kids like not to do it because they're saying, oh, well, I have my medical card or whatever,
Mhm.
but that doesn't mean that it's safe. And so that really is a scary topic. All right. So, Jason, we've got the next one on the list. We're going down. What do we got next?
Technology, AI, and autonomy. I think we're on the cusp of how are we going to integrate AI into healthcare, right?
Yeah.
How are we going to use autonomous vehicles? What's that all going to look like moving forward? And I think I called it scary in this list because I think we don't know yet. And it's moving so quickly. Are we going to make good decisions about that? And it's going to impact everything that we do. We were just at a conference in Missouri and we see drones flying medications out
Mm.
to rural health clinics.
Mm-hmm.
They can go up to 200 miles, at several hundred miles per hour, deliver something to a rural health clinic in a pre-staged landing spot, and all the health clinic has to do is have a battery there, go out, swap the battery, and press one button, and that drone goes back home. That's a huge tool to use. Just like we know with dictating notes, how that looks differently as we start to use AI to manage our whole clinical record. We can do better with diagnosing by letting the AI look at your entire history, but we have to have that data there for it to work. And I think it's scary to think about how are we going to be able to put all that together and manage it successfully.
Yep. And in that piece, you have to be thinking about what information went in and was it all accurate? Because if you get misinformation in there
Yep.
or a misdiagnosis at some point, and then it goes into an AI system, then you've really messed up your history and it could cause you to have all kinds of interesting challenges. And I know, and I've had some interesting health issues myself, and they were on a way to a diagnosis, maybe tried other diagnoses and maybe missed it along the way. And so if
Yep.
you don't get those removed from your record, then the next thing you know, you're going to be in the wrong space and they're trying to do the wrong thing. The other thing I just always like to talk about, even though that I have electronic health records now, I mean, it's just such a mess. And so I'm on the side of the reality of this technology is it's not awesome and people are still wrong. I got a medication just this week that's clearly on my I can't take it list. I go to the
Hmm.
pharmacy and what did the doctor send in? The exact medication I can't take. That is so
Yep.
unhelpful. And so I'm like, it's even on. I went and looked and I was like, well, maybe it wasn't on the list of what I can't take. It
Yep.
certainly is. It's actually at the top. So I'm like, then how do we get there? Right. And so it's scary. Yeah, there's a lot of good things coming forward in this technology space. But again, the unknown, the making sure things are accurate is going to be a humongous deal. And then, if you pull in your history, whatever was wrong, making sure we get that straightened out. So there's a lot to work there. All right. So number 6, Jason, this one is different. This one, transportation. Talk to us about what's scary in the transportation world.
Well, I think about transportation in rural America. It could be transportation by ambulance. It could be transportation to get to an appointment.
Mhm.
Transportation is a real issue. In our state, looking at Uber Health as a solution, I don't think always helps us in rural
Mhm.
areas because there's not a lot of Ubers in some parts of
No.
the state. And so even using the logic, we're going to free up people who want to drive from an urban area out to a rural area. I don't know if that's going to work, which kind of going back to the previous one, is there going to be a time that we see hospitals or healthcare managed care organizations using Waymos or autonomous vehicles to go pick up people and take them to their appointments?
Mm.
Because certainly we know the technology is there. We saw 4 different brands of autonomous cars when we were in Austin, cruising around the city, taking people everywhere. And so, how far are we from just, if we can't have people go do it, we're just going to send robots to go pick people up and go to their appointments. And I think about the risk and liability with that as well. And so, are we
Especially
closer
in
to that?
rural. Mm.
Yeah,
Mm.
but we may be closer to that than we think. So that is kind of scary.
Yeah. So on my working with my folks on the correction side, they've got a bus line that's been intricate in getting people from institutions to their
Mm,
next treatment location and in Western Iowa that are shutting down. And this is a
yeah.
real-time conversation. Like, we don't know how we're going to get people.
Yep.
And they were actually, as corrections, they were joking, but not joking, is maybe different officers become the transportation officer whose job it is to just be
Yeah.
on the road to take people to the places. Because if they have no buses, you
Yeah.
can't re-enter them into the community, into their treatment locations if they can't get there. And a lot of our folks
Yep.
don't always have supports for somebody to pick them up to get them places. And so you can't just leave them on the stoop at the prison. You got to get them to their next place. And
Yep.
so it actually is a really real issue, not just on the healthcare side, but in corrections and just across rural America in general. And so you're right. But I'm thinking about these autonomous vehicles and tractor crashes. I'm thinking of autonomous vehicles that, corners where you can't see with corn. And I mean, that
Oh, yeah.
wouldn't be their fault. All these different challenges in rural anyway for car drivers that aren't top of mind. I think
Yep.
it might be one thing to have the grid of a city down. It might be
Mm,
different to stick them out in rural America. Iowa's pretty square, so maybe it could pull it off in Iowa, but places like Minnesota where you're going all around all the lakes, I have no idea. I mean, I think it would be a really big challenge for those engineers, but they're smart people. Maybe they can do it. It'll be interesting to see where it goes, but we're going to have a problem in that one. All right, so number five here, Jason, on the list is data and research. What do you mean by that? Why is that so scary going into this year?
Well, it's kind of scary because we see lots of data and research, especially from the federal government, getting canceled. And
Oh,
so, are we going to have data and research to make informed decisions moving forward? I think it's kind of a scary time when we think about data, research, and science, because it used to be we would rely on data and research to make informed decisions about where we should invest, what programs we should invest in, or what's making an impact. And I guess if we don't have data and research that's valid or accurate, then how can we make good decisions about healthcare?
yeah, that's a very good point. And then you've got, I mean, I don't want to call anybody out, but there's some real misinformation and some really
Yeah.
bad data being shared on national stages, creating causation of things that is just not there and misusing the data that we do have. And so canceling data because you don't like the answers is never a good idea. And then promoting or getting somebody paid off to say that there's a connection when there isn't is just flat dangerous. And so I know this
If,
is number five on our list, but man, this one actually in my heart could be a lot higher because this
yeah.
one's super scary, the direction we're headed in all this.
If we can use opinions, I've got a lot of opinions. So I think I'm going to present my own data moving forward in all of our presentations, Renee, because I think I've got a whole bunch.
Oh, and then at the bottom, you could just cite it by Jason's
Yes.
opinion. Okay,
Yes.
we could have a JO on your pages and a RO on my pages, and we could just make stuff up. It would
Yes.
be, well,
Done.
I've been to those presentations, Jason. They're not my fave, but I digress. Let's get back to the list.
Oh,
All
back
right,
to the list.
back to the list. Number four we have on here is evidence-based practices. Why are these scary? Typically, these are good. So why are these scary, Jason?
They're scary because we see even in SAMHSA's framework that came out recently that evidence-based practices are a focus. And we know in rural areas, you can't always implement evidence-based practices to
Right.
fidelity. I do find evidence-based practices scary when there's no leeway, when we can't use evidence-informed practices that make sense in areas where we don't have the workforce and we don't have the ability to do it to the exact specifications that someone asks us to. And when funding is dependent upon doing an evidence-based practice to fidelity, it really limits who can do it, where it can be done, and it leaves a lot of people out. So I do find evidence-based practices really scary in rural areas.
Well, and I do too, because it ties back to what we just talked about with data. Because the only way it's evidence based in the first place is somebody collected data to prove that it was evidence
Exactly.
based. So if we're not going to collect the data or we implement it and never then look at the data, we're just implementing
Yep.
stuff, calling it this, and not ever actually proving that it actually did anything or worked. And we really struggle, especially in our legal system as legislators. We put things on the books and never put a sunset date or a review date to
Yep.
say, hey, let's look at this in 5 years and see if it actually did what we thought it should. Budget cuts, you name it, right? But when it comes to practices, we do the same thing in our, we decide we're going to do cognitive based therapy or whatever for this type of person. Do we actually measure if it's helped them stay out of the hospital, if it's actually helped them stay out of jail, if it's helped them live a healthier life or feel better about themselves? And we don't really do that. So then we've decided that this is the product, but we don't actually measure. And so you're right on both ends, creating the programs only to that level when it's almost never to fidelity and never ever researched the way it should be. And then ruling out all these other things that are up and coming that could be better because, well, it doesn't have that stamp of approval. And that you're right, that is really scary. All right, number 3 on the list is workforce. This one's scary, but I'm going to let you go first. But you tell me why you think it's scary, and I'll share why I think it's scary.
Well, I think our workforce is scary because we don't have enough of it and we
Nope.
misuse the workforce we have. So it's
Yep.
pretty much scary and bad no matter how we look at it, Renee.
No. And I think about workforce, like we just talked about the Missouri conference about how they lost 67% of their primary care in rural areas in a year. In a year.
Hmm.
And because we've been at this point where we've been projecting that the retirement age of doctors was coming. That day is here, everybody. The doc's ages are well into that retirement age. And so the ones that are staying in psychiatry are past the retirement age and doing it out of the goodness of their heart, maybe moving out of state, doing telehealth, whatever, to be able to stay working. But it is scary, and we don't have the workforce coming behind it to replace these doctors and that expertise. And so there's going to be a hole. And back to our topic about AI, it's not going to replace the psychiatrist anytime soon. And so we got a long way to go if automation's going to help replace psychiatry, and we're going to be in trouble. All right, number 2, isolation. Wow, this is high on
I
our list.
chose I chose isolation because I think that the more that we get separated from each other, the more that differences get in the way, the more that rural areas are disenfranchised from other areas, then the harder it is going to be to find healthcare and supports that we need. And so we've seen how isolation and social isolation impacts our physical health and our emotional health in study after study. The World Health Organization just put down another report this past summer that followed up on the report 2 years ago that was done here by our Surgeon General. And I just think that we can't underestimate the impact of social isolation in rural areas.
Yeah. And, the Surgeon General talked about this a couple years ago now. It's still pretty top of mind. It hasn't been completely integrated into our social determinants of health the way it needs to be. And all of this political fighting and infighting just pushes people away. People feel like there's less
Yep.
they can talk about with the family, less they can talk about with friends. They're afraid to bring things up, to have opinions, and it's just driving people apart. And none of that's good for anything.
Yep.
All right, last but not least, everybody, number 1 big scary thing for 2025, and this one's going to blow your minds, people.
Huge.
Please
Number
explain.
one scariest
Number
thing
1
by far
by
is
far.
Bigfoot. Bigfoot, Renee.
Bigfoot. I come on, readers and listeners, you're going to have to hear this one. Bigfoot,
In,
please.
in some areas known as Sasquatch.
True.
This is the scariest thing that's going to impact rural communities by
How is
far,
that?
Renee.
How is Sasquatch going to impact rural communities the worst? Jason, please explain.
Well, because we need to be worried about it. We need to be scared that Bigfoot is coming for us, Renee. I mean, aren't you worried about Bigfoot?
No, I can't say that I am. There's other things in my world that's a little more scary than Bigfoot. But Jason, why does this matter so much to you today? Why do you care so much about Bigfoot?
Well, because as I did some research about this, I was able to find the geographic database of Bigfoot Sasquatch sightings and all the reports by state and province across North America. And as I dug into the data, I realized that I have more data of Bigfoot sightings than I do in my own state of behavioral health transfers of individuals between different levels of care. And so it made me think, if we can have all of this data around Bigfoot, maybe we should be more worried about Bigfoot, because statistically, we're more likely to have a Bigfoot sighting than we are to find behavioral health care access.
Wow, that is quite the statement. So we are more likely to have a Bigfoot encounter than to actually figure out where the front door is to get somebody into behavioral health. And there's
I
more
believe
data to
so.
prove it. That's
I
insane.
believe
That is
so.
a
I believe there's
fantastic
more
scary.
data. And so
Wow.
we'll have in our show notes how you can access how many Bigfoot sightings have been in your local state or province in the last, I think it's 10 years of data here. It's really a comprehensive, you can sort it by
Wow.
different ways.
Wow.
You can see
Well,
pictures.
I have a theory. If THC is going to double in Texas, we might have more Bigfoot sightings. In my opinion, as these things all change, we might have more and more sightings of Sasquatch. And maybe, but that isn't actually going to fix our workforce issues. No. But I think that
So
we'll see even more in Texas moving forward. And probably a
since
lot
data
in
has been
Colorado
collected,
already.
Texas has had 259 Bigfoot sightings, which I wouldn't think Texas was a big state for Bigfoot. Washington state actually leads the pack in
That's
Bigfoot
not a
sightings.
surprise. That's not
You
a
know,
surprise.
well, I
That's
know,
not a
and
surprise, Jason. They have legalized marijuana quite a while back. That's not a
I know,
surprise.
and it won't
Colorado's
surprise
probably
you.
up there. Colorado's up there too.
It is. We should no. It's only 131 in Colorado. California has 465 Bigfoot sightings.
I'm not shocked there either. So you see,
Now, this
Jason,
won't shock you. Rhode Island and Delaware have the least amount of Bigfoot Sasquatch sightings. I know, like this mind
okay,
blowing. This data.
mind blowing, mind blowing. Well, that is very scary. Well, everybody, I hope you really enjoyed our top 10 list. And the Bigfoot sighting is number one this year for the most scariest thing because you can see Sasquatch more than we can find access to behavioral health. And folks, that is awfully scary. Before we go, though, recovering politician self-care policy of the week, I tied it to our topic. There are scary things in your environment that you might not be thinking about that might be tripping others up. Let me explain. If you've got somebody who's an addict, whether it's alcohol, whether it's drugs, whether it's, I don't know, junk food, if you're not paying attention to the things you have in your home, you could inadvertently be not helping somebody on the recovery journey. It could be in your workplace as well. So you could have products, things around you that have alcohol in them that you would never think that somebody might ingest to continue on their addiction journey, and they do. And so the safe thing to do for this holiday season is to make sure you know what's in your environment. Those extra pills in I just went into my Hy-Vee. There's a big box up front where I can throw away old prescriptions. Getting those things out of my house when I have kids in my house. I don't know. I'm not going to notice if they disappear necessarily because they're not things I use on a daily basis. And that's how kids get into these things. And so just over this holiday season, as we're going into the holidays, make sure you get rid of stuff in your homes, get rid of stuff that could be causing issues for people. I mean, and if you drink, fine, but that doesn't mean you need to have the alcohol in the house if your recovering sibling is there for the holidays. You can make a day where everybody's going to be on the same page to help them recover. Make sobriety an easy choice for people that are living addicted lives. And that's my self-care policy for myself and for everybody else. So today, everybody, we did the top 10 scariest things in the behavioral health in 2025. Well, there's a lot of not so great stuff in 2025 out there, and we just wanted to highlight it all for you. Next time we get together, we'll talk about some of the things that we can do to protect ourselves from all of these scary things. We'll see you next time. Have a great day, everybody.